Designed and managed by Outreach Extensions and POV, the Critical Condition National Outreach Campaign and this program is made possible by generous funding from the Annie E. Casey Foundation, the Charles A. Frua Foundation, the Fledgling Fund, the Kaiser Foundation Health Plan, Missouri Foundation for Health, the Nathan Cummings Foundation, the Park Foundation, the Spunk Fund, and the Trull Foundation.
In Wisconsin, I basically have not been able to get health care insurance at all. I've been rejected by numerous companies.
I had to quit my job to get the health insurance that I need.
I am covering now 2 years worth of medical bills, and those copays and deductibles and out-of-pocket expenses add up very quickly, especially with something like cancer.
For many Wisconsinites, the rising costs of health care and medical insurance are sending family budgets into intensive care.
Between 2000 and 2008, health insurance premiums have gone up about 100%, while the median family income has gone up about 13 to 15%.
A number of people are paying 10% or more of their income on health care because employers have shifted some of the costs in terms of co-pays or premiums.
The average income for a family in Wisconsin is a little over $40,000. Well, a health HMO premium would cost about $12,000. That's over 25% of a family's income.
There are people who are going bankrupt in this state and nationally because of health care costs.
There are two main problems. One is that there are about 500,000 people who have no insurance at all. And then there are many people who are paying way too much for very bad insurance, what we call the underinsured.
But the numbers don't begin to tell the human stories.
Christmas morning of 2006, I woke up and was ready to open gifts with my family, and I noticed very bad headache. I was just in horrific pain, actually. And I began to feel nauseous. I was dizzy. I got up, went to the bathroom, and vomited. I was very sick, and came back to where my husband was, and he noticed that my speech was beginning to be slurred, and he said, "You know, I think you need to probably go to the hospital. You're slurring your speech." And I said, "You know, this is Christmas morning. There's no way I'm going to, miss our family gift opening for that. I'm sure I'll be fine." And that's the last thing that I remember before going into a grand mal seizure. My kids ran to call 911, and my husband stayed with me, and eventually the ambulance came and I was transported to the hospital. I was in and out of consciousness most of the day, and later on in the day they came back with the news that I had a mass in my brain.
Lori Kubin is a married mother with 2 children. Her cancer is currently stabilized, but she needs MRIs every 3 months, as well as weekly blood tests.
And there is no one consensus as to the best treatment for my type of tumor. There are several hundred different types of brain tumors, each one unique to obviously that individual, but also unique in and of itself. So at this point we've chosen to do watch and wait, which means that I have MRIs every 3 months. I have blood work and so forth to monitor the stability of the tumor. It's been about 19 months now, and it has remained stable to this point. So things are going very well. There are obviously physical issues, mental, emotional, spiritual issues, and of course financial issues. So I feel incredibly blessed that I emerged from surgery with no deficits. I have a good prognosis. I'm in great health otherwise. So you're taking one day at a time and trying to make the best of every day. Really enjoy what you have, which is this moment in time.
Lori has insurance through her husband's employer's plan, but his hours have been cut to part-time status. Benefits are still offered, but the monthly premium has increased from $1,000 to $1,500, and there are co-payments and deductibles.
I do have insurance, and like everyone else, I assume that insurance would adequately meet any medical needs that I would have. As I stated, my condition presented itself on December 25th, which is only a few days before the end of a calendar year. So I had deductibles, co-payments, medical, pharmacy bills for that year, just those few remaining days that I needed to meet before my insurance would take effect. And then I was hospitalized through that New Year's period until the next year. So now I have 2007 years worth of co-pays, deductibles, and so on and so forth. So I am covering now 2 years worth of medical bills. And those co-pays and deductibles and out-of-pocket expenses add up very quickly, especially with something like cancer.
The state provides some assistance for citizens through its BadgerCare Plus program. Former Governor Tommy Thompson created BadgerCare, which went into effect in 1999. The program was created to provide health care coverage to Wisconsinites whose employers did not provide it and who made too much money to be covered by Medicaid. Under Governor Jim Doyle, the program has expanded to cover all children in the state under 19 years of age and families.
BadgerCare Plus is Governor Doyle's effort to make sure, first of all, that all children in Wisconsin have access to comprehensive, affordable health care. We know that we need all of our children in this state to grow up healthy if Wisconsin is going to realize its full potential. We have far too many of our kids who, prior to BadgerCare Plus, were having trouble accessing affordable health care. So as of today, just since February 1st, we've signed up over 60,000 more children for health care coverage in BadgerCare Plus. So that's terrific. But BadgerCare Plus isn't only for kids. It's also for parents who don't have access to affordable employer-sponsored health insurance. We're covering more pregnant women. We're covering children aging out of foster care. So all of those groups are now eligible for affordable health care under BadgerCare Plus. The BadgerCare Plus really is meant to cover that gap between employer-sponsored health insurance and people who don't have access to it. So for people who are between jobs or for people who work for an employer who doesn't offer health insurance at all or doesn't offer health insurance where the employer pays at least 80% of the premium, those are people who are eligible for BadgerCare Plus. There are some income qualifications that people have to meet, and more information about that is available on our website at badgercareplus.org.
The program is expanding.
We have a brand new phase, if you will, of BadgerCare Plus, a brand new expansion of BadgerCare Plus. We just have gotten approval from the federal government to expand healthcare services to adults who, just as you said, don't have access to employer-sponsored health insurance at all and don't have children living at home with them right now. And this has been a group of people that traditionally has had a very difficult time finding access to affordable health insurance. So this is a program that's available for people up to about $20,800 of income a year for a single person and about $28,000 a year, of income for a two-person household.
Even with government assistance, there are challenges.
Cut that one too close.
Alan Newson began to show signs of multiple sclerosis at 26. Within a short time, the disease made him immobile.
MS attacks the sheathing or the myelin of the nerves in your central nervous system. And it attacks that, and it's like a frayed cord. It takes away the sheathing, so the nerves are exposed, and since the body's trying to heal itself, it makes scar tissue on the exposed nerves, and it blocks out the nerve connections, blocks out the nerve connections, and you end up losing motor functions and stuff like that. I am a volunteer teacher at MATC in the television and video production, and I graduated from that program in 1999 and did a lot of stuff in television, worked at a bunch of stations in Milwaukee. And when I wasn't able to work anymore, I went down there and got in, and here I am now.
Every 2 weeks he undergoes plasmapheresis,
which is a treatment where the plasma is taken out of my blood and replaced with synthetic plasma. So the body has to reset itself and make all these antibodies again, and it slows down the progression of the MS.
It is a treatment he could not afford without assistance.
I have the state Medicaid, which is called Title 19, and I also finally got my Medicare, which is a good thing because now I'm one of those rare people that have double coverage. So sometimes I've been told I have too much health insurance now, which is funny because when I didn't have any, it's what can I do for you and what can you do for me? Well, I can't do anything for you right now because there's no guarantee that I'll get paid for my services. So I applied, got approved, and little did I know is that I went back to work and went to get one of my prescriptions filled. And the pharmacist told me that'll be $150, sir. And I was, $150? Why would that be so much? And the person told me, well, Medicaid is not approving this. And I just, what are you talking about? So since I really needed that medicine, I paid for it out of pocket, which was a big hit for me. And finally got a hold of somebody at the Health and Human Services building, also known as the Welfare Building. And the person on the phone told me that, well, you don't qualify for Medicaid anymore because you're working again. What? Are you telling me that the little money I make is too much for me to qualify for the program that supposedly helps people in my situation? She said yes. So I had to quit my job to get the health insurance that I needed.
It shouldn't be the case that a person has to choose between working and health care. Those two things ought to be able to go hand in hand. And so for a person whose health care benefits are dependent on their disability determination, and for that, for them to be required not to seek gainful employment in order to maintain those disability benefits, there's something wrong with that picture.
Remy Cece is a cancer survivor with a different problem.
I was only 39 when I was diagnosed with gastric lymphoma, so everybody was pretty much taken by surprise, especially me. So I had family and friends do things like come and walk my dog, or pick up all my laundry and return it all fresh and folded, or drop off groceries, or send me checks. I just had a tremendous amount of support, and I would not have been able to survive. I had people pick my mother up at the airport and take her back when she came out for the surgery, and just a tremendous amount of community and family support. I was in California working for an export company at the time. I am a pretty healthy person in general. I don't smoke. I drink only in moderation. I eat a pretty healthy lifestyle. And I started to have some gastric distress that I thought was just, ulcers or something mild. But after a series of tests, I was diagnosed with gastric lymphoma, which is lymphoma, and it was located in the stomach cavity of my body. I had to have surgery. They took out about 2/3 of my stomach, and then I had a round of 6 months of chemotherapy.
Remy has been cancer-free for about 20 years. She returned home to Wisconsin and discovered that she could not get affordable health insurance.
In Wisconsin, I basically have not been able to get health care insurance at all. I've been rejected by numerous companies. Every time I call, they check with underwriting when they find out I'm a cancer survivor, and they just say no, they won't even take my application. It's a huge problem. I basically have no health care insurance, which means I have to pay for every doctor visit, 100%, any medications I might need. Fortunately, I'm healthy now, but because I have this pre-existing condition, I can't get routine health care, and heaven forbid something should happen where I would need catastrophic care.
Remy's pre-existing condition also affects her employees.
I own a small business, and I can't get affordable health insurance for my employees, because I skew the pool. Because I'm uninsurable, the policy would be prohibitively expensive for my employees as well. One policy that I did find for me was going to take basically half my take-home pay just to cover health insurance. We have about 12 employees. The coffee roasting business is a year-round business. We gross about $500,000 in sales every year. We have a number of employees who are full-time, and then quite a few employees, especially in the cafe, are seasonal or part-time employees. I'm very frustrated. I feel a little cheated. I'm born and raised in Wisconsin. I've paid taxes here. I own property here. I own a business here, and I can't get health insurance. I could be a felon and be in jail and get health coverage. I could be an illegal alien and get health coverage. I could be an unwed mother on welfare and get health care coverage. But I'm a working stiff, and I can't get health care coverage.
This is a real challenge for people, and one of the things that we are looking at in particular in the area of people who work for small businesses is exactly how to address this problem and how to make health insurance more affordable for the almost 1 million people in our state who work in small business settings. So that would be employer groups of anywhere between 2 and 50 employees. And we are working at the governor's direction on a series of reforms that not only would address that pre-existing condition question, but also would work to just hold down the overall growth in healthcare costs for people working in small business settings, and that would also really enable them to sort of pool their collective buying power and strike a better deal in the insurance marketplace.
I think that our consumer protection rules, we've done some very good jobs regulating part of our market, but for some reason we do not have those rules on insurance companies with regard to health insurance.
Senator Vinehout is a sponsor of Healthy Wisconsin, a comprehensive health care proposal that passed the Democratic majority Senate in 2007, but failed in the Republican-controlled Assembly.
The proposal is bringing the same coverage that I have as a state employee and as a state senator to everyone in the state of Wisconsin that now doesn't have coverage. So the kinds of people that would be covered are all those people that are not yet eligible for Medicare, but are making too much money to be eligible for Medicaid or BadgerCare, the state health plan for those people of low income. Those people in the middle are about 3 million people here in the state of Wisconsin. And those are the people that right now either have coverage through their job, or they have maybe a very bad policy that many people I know are paying a lot of money for very bad insurance, or they can't get any insurance at all. And these people would have the option to buy or choose many different kinds of insurance.
I think the Healthy Wisconsin proposal has a very constructive approach to the problem of eroding insurance coverage among employers. It, in essence, says we're going to lift that burden off of you, and we're going to create opportunities for people with jobs to gain access to a much bigger, broader pool of insurance. We're going to use payroll tax revenues that are similar to what we now pay into Social Security and Medicare for coverage across the state. I think it's a very good idea, potentially.
But many legislators are skeptical of the proposal and of the need for government support.
The idea that we need these Cadillac plans in order to have a decent health care program is not accurate. Inevitably, the government does not deal as efficiently with any commodity as the private sector. It would increasingly become more expensive over time. We would become a magnet for any sick people or people without health insurance in the Midwest, if not the entire nation, if not the entire Western Hemisphere. I mean, it would very quickly break the state because business would have to pay for this cost. It would make Wisconsin, I think, very quickly about the worst state to do business, and it would be a disaster for Wisconsin's economy.
Healthy Wisconsin, by our actuarial estimates, would need $15.3 billion to be able to take over all the insurance premiums that are now being paid for, which are roughly about $17 billion. So we're looking at saving, just on administrative costs alone, we're looking at saving over $1 billion.
Because Healthy Wisconsin relies on taxes of business to pay for it, you're going to wind up in a situation in which more and more of the high-risk population comes to Wisconsin. And the more you make Wisconsin a business-unfriendly state, business begins to leave the state. So you have more and more people eating up our resources and less businesses to pay the tax. What's going to happen? It's going to be a financial disaster.
Although the fall elections have given Democrats control of the state capitol in Madison, the prospects of approving new major initiatives are less likely during hard economic times. In Milwaukee, cost is not the only concern with gaining access to health care.
We don't have enough physicians willing to work in the central city of Milwaukee or in some of the rural areas in the state.
In the last 30 years, probably 9 or 10 hospitals have closed, serving a vast area from the downtown going north to about Silver Spring. This process, unfortunately, is likely to continue. Simultaneously, where there used to be dozens of doctors in this area, we're talking about maybe a handful remaining.
But there are efforts to provide reasonable access.
So now, since the last time we talked, has the pain gotten better or has it gotten worse?
It got worse.
The Immediate Care Clinic has been operating for 23 years.
We've been averaging, in recent years, 15,000 patient encounters a year. And we see patients both primary care and urgent care. As a matter of fact, at least 25% of our patients come from throughout the whole metropolitan area. People don't get sick by appointment, and they want to know that the doctors are going to give them the time they need. What this model also recognizes that healthcare is still first a profession, also a business, but first we tell our doctors, take the time you need to practice good healthcare. And we give them all the support that would recognize that doctors are not just employees. There's a special relationship between physicians and their patients, and we try to preserve that here.
The Marquette Neighborhood Health Center is working to reduce costs by using nurse practitioners.
These advanced practice nurses can provide 80 to 90% of care within their scope of practice. That's not eliminating physicians. You still need physicians to provide some components of primary care or specialty care. But if we were to have a staff mix that better utilized advanced practice nurses, and also physician assistants are another advanced provider group, we could reduce healthcare costs without reducing quality.
All of these efforts are attempts to bring down the cost of health care.
Healthcare is a bit like a balloon. If you only deal with one part, say you only fix the uninsured part, it's going to pop out over here. So what I'm suggesting is comprehensive. Look at the entire balloon. Look at the insurance companies. Look at the doctors and hospitals. Look at the patients. How can we help change patient behavior? And then look at government. What is government doing that it needs to do better? What is it not doing that it should be doing?
In the private sector, what we're doing is we're going with more and more health savings accounts with deductibles, and sometimes frequently the employers even give employees money towards those deductibles. But because there are deductibles, the employees all of a sudden begin to shop for different doctors, different clinics. The employees begin to ask, is this test really necessary? Do I have to go to the chiropractor these many times? And what they find out is you get a dramatic reduction in healthcare costs.
In the next year, it's going to be extremely pressure-packed as to whether Governor Doyle and the new legislative leadership can maintain and sustain, let alone build, the public health insurance programs that have really done so well for us in the last few years here in Wisconsin.
Sitting here today, I don't think there's any question but that significant healthcare reform is going to move forward. I think it's both nationally and that we will be able to continue to move forward here in Wisconsin. I think what may have to happen is we may have to move forward at a slower pace than we all would like. But the reality of it is that, you know, both the national and the state budget picture require us to just take a step back, to consider all of our options, and to say, you know what, the goals of comprehensive, affordable health care for everybody in this state and for everybody across the country, those are still the right goals. And now what we need to do is work toward those goals step by step, and if it takes a little longer than we thought, it takes a little longer. But still, we're going to keep moving.
Designed and managed by Outreach Extensions and POV, the Critical Condition National Outreach Campaign and this program is made possible by generous funding from the Annie E. Casey Foundation, the Charles A. Frua Foundation, the Fledgling Fund, the Kaiser Foundation Health Plan, Missouri Foundation for Health, the Nathan Cummings Foundation, the Park Foundation, the Spunk Fund, and the Trull Foundation.